videos what I have been taking up in pharmacology. So students and viewers in the professional exams, you all might be asked about the certain short notes in the form of short essays you are supposed to write about the parenteral iron preparations. So in such a exam, you are supposed to write about in a very short form about the parenteral iron preparations, and it comes as a short note or in the form of a short essay. So this video will be mainly discussing about the parenteral iron preparation and how it is, in what all forms it is available. So students and viewers, beginning with, so parenteral, before getting into the detailed discussion of this topic, we need to understand that what is the meaning of parenteral. So we can split the word that it is made up of two words. One is par and next is enteral. So enteral root, when it refers to anything what is administered through the oral cavity, it is referred to as the enteral route, which passes through the mouth or in the alimentary canal. And when we look at the term parenteral, so it is absolutely referring to a condition which is going to avoid, or the thing what is going to be passed through a route which is eliminating, which is excluding the oral or the alimentary canal route. So in this condition, the term this parenteral is being used. That parenteral is such a condition whenever a drug is administered from any other route apart from any other route else than the oral or the alimentary canal. So parenteral iron preparations, in indirect term, it can be referred to as that whenever a drug is given in the form of an injection or it is given through an intravenous route. So any vein, if it is the drug is administered through the blood circulation, so that is a parenteral route. That is the parenteral method of delivering a drug. So in certain conditions, it becomes very important that there are certain conditions of the body where the body is unable to tolerate a certain amount of a dose which is given orally. So in such conditions, the doctor advises that such medications needs to be given through the intravenous, intramuscular, subcutaneous, different routes are there for parenteral administration of a drug. So in this video, when we are talking of the parenteral iron preparations, so iron preparations, they are as follows. So first is what is the very commonly used, it is the iron dextrin, which comes in the brand name of Imferon. So this iron dextrin, what is given, it is given in the form of an ampule as comes, and this ampule is containing 50 milligram, and absolutely it is going to come in 2 ml of ampule. So 50 milligram of iron is being supplied in 2 ml of the ampule, which is given through the intravenous or the intramuscular route. So this Imferon or the iron dextrin, it is most commonly used parenteral iron preparation used. So the most commonly used parenteral iron preparation, it is the Imferon. It is the brand name. It is coming with this name in the market, and actually it is containing the iron dextrin solution. So it is most commonly given by the IV or the IM route, and this is the most commonly iron preparation what is used in patients who are indicated for this parenteral iron administration. Now next is the iron sorbitol citric acid complex, which comes with the brand name of Jectofur. So this iron sorbitol citric acid complex, which in the market it is available in the form of Jectofur. So what it is containing is, it is containing 50 milligram of iron per ml of the ampule, and it is mostly given through the intramuscular route. So most importantly, this Jectofur, which is the iron sorbitol citric acid complex, it is always given through the intramuscular route and never it is given by the intravenous route. So students and viewers, do remember that point has to be kept in mind, that when that is the iron sorbitol citric acid complex, it has to be given by the IM route and never through the intravenous route. So this can be asked from you in the form of a multiple choice question in your various competitive exams. Now moving on to the next third preparation, the parenteral preparation, it is the sodium ferric ferric gluconate. So this is the combination of sodium and ferric gluconate, and recently the most commonly now what is being approved by the guidelines. So recently approved the preparation for intravenous parenteral administration. So it is the sodium ferric gluconate. And why it is being recently so much approved? It is the most commonly and the recently approved drug for parenteral administration of iron. Why? Because it has much lower risk of anaphylactic reaction. So whenever certain iron preparations are infused, it is given through the IV route or IM route, it is going to elicit certain kind of anaphylactic reactions. So this newer recommended, recently approved sodium ferric gluconate, it has been found that it has a much lower risk of anaphylactic reactions than when it is compared with the iron dextrin. So iron dextrin I've already discussed. So this sodium ferric gluconate, it has lesser risk of having an anaphylactic reaction when compared to the iron dextrin, what we have earlier discussed. Now moving on, how to calculate this parenteral iron preparation. So students and viewers, very important, this formula needs to be remembered, that the iron requirement of a particular patient can be calculated with this formula. So if a patient is anemic, if he is having a deficit of iron reserves in the body, so how to calculate that, how much iron needs to be infused, how much iron needs to be administered. So this formula needs to be remembered, that the iron requirement in milligram is equal to 4.4 into the body weight of the patient in kilogram, and into multiplied by the hemoglobin deficit in grams per deciliter. So with the help of this formula, we can very easily calculate that how much is the dosage of iron, how much milligrams of iron is required for a particular patient who is having certain amount of a deficit. So the formula for iron requirement in milligram is 4.4 into the body weight of the patient in kilogram, and into multiplied by the hemoglobin deficit. The unit has to be in grams per deciliter. So the next iron preparation is intramuscular injections is given deep intramuscularly, particularly in the gluteal region. So in the hips and in the buttocks region, the intramuscular injections is being given for iron preparations, and mostly the technique what is involved, it is the Z technique. So students and viewers, again do remember that if intramuscular iron preparation is to be given to the patient, so it has to be given through the Z technique, where the skin and the subcutaneous tissue, it is pulled apart firstly, and then this iron infusion is being administered at the injection site. So this Z technique is very important. Why? Because it is going to help to avoid skin staining at the injection site. So whenever iron preparations are given to the patient, if it is not followed the Z technique, there might be a chance the site where the iron is being administered, it might stain, it might cause staining of the skin. So just by following the Z technique in the intramuscular route of iron administration, the staining can be prevented, the staining can be avoided. Now moving on to the last important point, that intravenous iron is given very slowly, and particularly the time duration is from 5 to 10 minutes, or very slowly it is given as an infusion. Now in short, we are going to we are going to see that what are the indications of this parenteral iron preparation, iron administration. So the indication includes, the first is the when oral iron is not tolerated. Obviously, if it is given through the parenteral route, intramuscular, intravenous, these all techniques what I've discussed. So either it be the IV route, the IM route, whatever techniques it was administered. So most important indication is that if oral iron is not tolerated. Next is if the patient is unable to absorb, the failure of absorption of iron through the oral route is not happening. So that's the next indication for it. Non-compliance, if the patient is unable to take iron orally. So in such a condition, this parenteral iron preparation needs to be given. And lastly, if the patient is having deficiency of iron and in conditions where severe bleeding has occurred and bleeding tendencies. So this is another indication for parenteral iron preparation. When we look at the adverse effects of it, so adverse effects can be seen into two forms. One is the local adverse effects and next is the systemic adverse effects. In the local adverse effects, what we can find is that whenever the iron preparation is being injected through the intravenous or the intramuscular route, pain at the injection site is the most common adverse effect. So pain at the injection site is the most common. And when we look at the systemic adverse effects, it can occur that the patient who is being given this parenteral iron therapy, he might experience for a short duration of time, there can be fever, there can be headache, there can be joint pain, there can be palpitations, that the patient may become conscious of their heartbeat. Apart from this, there can occur systemic adverse effects in the form of difficulty in breathing. There can occur lymph node enlargements, and rarely it has been found there can occur anaphylaxis as well. So students and viewers, this was a very short discussion where I've given you in simple terms when it comes to write in the professional exams a short essay on parenteral iron preparation. I have summarized all the types of parenteral preparations. If you still have any queries or comments, you are most welcome to comment me in the comment section. And students and viewers who are new to my channel, who haven't subscribed, subscribe and don't forget to press the bell icon so that you can be further updated for my upcoming videos. If you like this video, give this video a thumbs up. Thank you for watching.